The human body operates as a highly interconnected network. When a single biological process breaks down upstream, it forces a massive chain reaction of failures downstream. A prime example is insulin resistance, where cells stop responding to blood sugar hormones. Combined with obesity, it acts as a central error code, broadcasting distress signals. This drives knee osteoarthritis, obstructive sleep apnea, elevated cardiovascular risk, and metabolic liver disease. For decades, modern medicine has managed these symptoms individually. Treating the joint pain, the sleep apnea, and the blood pressure separately is a standard approach because targeting all those metabolic drivers at their shared root has historically been difficult. To address this difficulty, researchers are investigating a new peptide-based metabolic medicine, Retatrutide. You might hear this drug informally referred to as a triple agonist because it engages 3 specific biological levers at the exact same time. You might also hear the term GLP-3 used online, but scientifically, that term is incorrect. By targeting 3 distinct physiological pathways simultaneously, Retatrutide aims to rewrite the upstream source code of metabolic disease, addressing the core engine of the cascade. To understand how this works, we have to look at the microscopic reality. Retatrutide is being studied as a once-weekly subcutaneous injection that travels through the body to interact directly with metabolic hormone receptors, the specialized protein structures on your cells that receive and process chemical instructions. This visualization of a 3-part dial system illustrates the drug's first target, the GLP-1 receptor, which primarily manages intake. Activating the GLP-1 receptor slows down gastric emptying, keeping you full longer. It prompts your pancreas to increase insulin secretion in response to glucose, and it sends signals to the brain to increase satiety, reducing your appetite. Retatrutide also targets a second lever, the GIP receptor, which acts as a complementary amplifier to the first. GIP activity further improves the body's ability to secrete insulin in response to food. When combined with GLP-1 activity, it provides compounding support for overall weight and metabolic regulation. Together, these first 2 biological levers restrict the calories entering the system and optimize how the body processes blood sugar. Controlling intake addresses half of the equation. The other half is the physiological challenge of output, how the body burns the energy it has already stored. Returning to our mechanical model, we can see the third lever that makes this medicine unique, the glucagon receptor. While the first 2 dials manage intake, activating the glucagon receptor targets energy expenditure, the rate at which your body burns calories. It supports fat metabolism and specifically helps clear out excess fat accumulated in the liver. Because of how these levers interact, the clinical results happen on 2 different timelines. Some effects, like appetite reduction and early gastrointestinal changes, occur early in the treatment process. As this graph shows, the larger systemic alterations, significant weight loss, the reduction of blood sugar markers like HbA1c, and broad cardiometabolic improvements build slowly over many weeks and months. Retatrutide forces a multi-system rewiring of appetite, glucose, and energy balance. Its clinical value is measured in sustained physiological transformation over time, not immediate fixes. Despite that biological promise, we have to look at the strict, highly regulated landscape of clinical implementation today. Retatrutide is strictly an investigational medicine. It is currently unlicensed in the UK, and it is not available through routine NHS prescription. Access is legally restricted to monitored clinical trials. Within those trials, doctors are monitoring for physiological side effects. The most prominent issues reported are nausea, vomiting, and diarrhea, which carry a risk of severe dehydration if left unmanaged. There are also complexities regarding drug interactions. Combining this treatment with existing medications like insulin can increase the risk of severe hypoglycemia. Additionally, because the drug slows gastric emptying, it alters the absorption of other oral medications. Even if regulatory approval is achieved, this drug will require a comprehensive treatment framework. To be effective and safe, it will involve structured dietary support, ongoing behavioral changes, and consistent physical activity. Because of its multi-pathway effects, buying unregulated products marketed as Rita online carries extreme medical and legal risks. Products sold outside of official clinical trials may be incorrectly dosed, contaminated, or fake. If fully approved, Retatrutide functions as a sophisticated, synergistic tool, one that requires careful medical management to finally dismantle the root upstream drivers of metabolic disease.